I'm now joined by global affairs analyst Michael Bociurkiw. He's in Sydney, Canada. Hello to you, Michael. Is any of Donald Trump's criticism of the WHO justified?
Of course. Good to be with you, by the way. He's not the only world leader to come out and speak against the WHO. We all know that it's in need of reforms, like many UN agencies. But now is the wrong time to decapitate the WHO. Unfortunately, I think Mr. Trump is deflecting criticism from his own deplorable record. I don't think he realizes that handling a health emergency is different than selling a condominium building in New York City. He spent a whole month doing absolutely nothing, but to tell the WHO that their funding is going to be cut in the middle of this pandemic is not only depriving them of badly needing funds, but also perhaps signaling to other countries that they too could deprive the organization of badly needed money as well.
But is there anything to the allegation that the WHO relied too heavily on data from China in terms of its response to the pandemic?
Well, I've been sitting on every WHO briefing pretty much since early January, and I have to say that my jaw did drop in early January when they said that China was setting the gold standard in terms of fighting an epidemic or a virus spread. We know now that they did really cover up figures, and we're late to the game in terms of declaring that there was an emergency within our own country. So there is a certain closeness that makes us kind of uncomfortable with the WHO, not only with China, but with other member states as well, which makes them a bit too close to these countries, and hence they don't allow themselves to hold these countries accountable.
So if this funding cut from the US does come through, how's that likely to impact the World Health Organization?
I think the symbolism is more important than the dollars and cents. I mean, the U.S. contributes, 15% or so to the budget. And by the way, the WHO budget is about the same, or actually less than the budgets of many U.S. university hospitals. So it goes to show you that, they do a global kind of mandate on very little funds. But I think where it really hurts them is their moral credibility, that when they do speak, and we've a long way to go in terms of seeing the end of this pandemic. When they do speak, it may not give them the same moral authority as they once did, and that would be very, very bad.
And what should the rest of the world do now in response to the action that the US president has taken?
Well, I think continue what they've been doing. I mean, the United Kingdom just gave a multi-million-dollar donation to WHO to fight the pandemic. Look, we're crossing a very important line right now, I think, in terms of fighting this coronavirus. I think what we're all hoping for and praying for is that doesn't really hit hard on a lot of countries with weaker health systems, especially in Africa, because most of those countries have very weak ministries of health, and that is where the WHO expertise and ability to mobilize will really come into play. So God forbid that it isn't able to operate at that time.
Okay, that's Global Affairs Analyst Michael Bociurkiw in Canada for us. Thank you.
Pleasure.